Today we are going to deal on the most important topic, so that is diabetic insipidus. Yeah, before going to the diabetic insipidus, we should know the some basic things are related to the, so that is antidiuretic hormone. Here, the antidiuretic hormone also we call as an, so the vasopressin or a arginine vasopressin. Here, it is usually secreted or synthesis takes place in the hypothalamic nerve cells and storage takes place in the, so that posterior pituitary gland. One of the most important function for the ADH hormone is to regulate the water balance in the body. Here, whenever so the body need is there, so that is posterior pituitary gland releases, so that is vasopressin. If the vasopressin's deficiency is there, means it may lead to one condition, so that condition will call us, so the diabetic insipidus. Here, the diabetic insipidus also we call as an original vasopressin deficiency or original vasopressin, so the resistance. Also we call as an central diabetic insipidus. Yeah, the common incidence is it usually affect 1 in 25,000 people. To what happens in case of, so that is uh, so the diabetic insipidus due to the deficiency of, so the antidiuretic hormone. So that is either it may be pituitary gland or it may hypothalamic. So there is excessive loss of, so the water from body takes place. Now come to the what are the causes of, so that is so the diabetic insipidus: head injury, genetic, so that is pregnancy, and the medications. Also it will cause, so that is diabetic insipidus, but exact causes unknown. Now what is easy memory for, so this the causes for the diabetic insipidus is head, okay, head injury and other different disorders, so that is antidiuretic hormone deficiency and some medications or drugs. Now come to the types of, so that is diabetic insipidus. Then it is divided into the four different types of brains, so that is diabetic insipidus, the central diabetic insipidus. Here, so what happens? It is very common, so that is diabetic insipidus. In this condition, so there are options of, so that is antidiuretic hormones takes place. Now come to the nephrogenic diabetic insipidus. Here, the already antidiuretic hormone is there, but kidney nephrons, so they're unable to, so that it use the available, so the ADH hormone, they develop resistance against the ADH hormone. Now come to the dyspogenic, so that is diabetic insipidus. It is resulting from the, so the body mechanism, okay, so the defect in the, so the body mechanism. Now come to the gestational, so that is diabetic insipidus. The gestational in diabetic insipidus, what happens? The placenta also secretes, so the vasopressins. Okay, so it adversely affect on the arginine vasopressin. Okay, so it doesn't able to, it doesn't allow us to work so properly. Okay, so it may lead to, so the loss of more water from the, so the body. Okay, so it may lead to a condition, so that is gestational diabetic, so that is insipidus. About the, so clinical manifestations, what are the clinical manifestations we are going to see in case of, so diabetic insipidus? So that is for easy remembering, so that is drink. Here the dehydration, so restlessness increased, so that is thirst. Okay, so that is for polydyspnea, so that is nocturia. So the more urination usually at the night time, the kidney unable to hold the water, so the loss of, so the more, so the water from the body, so that is we call as polyuria. So that is polyuria and polyuria is the most common. So the symptoms were seen, so the symptoms were seen in, so that is diabetic insipidus. Now from so management, okay, for easy remembering, so that is water. It means, so that is maintenance of the hydration by the, so intake of more water. So the E is nothing but, so the antidiuretic hormone replace, okay, so replacing the antidiuretic hormone, so the synthetic forms, that is desmopressin. So it is nothing but treating the underlying disease, treating the underlying causes like infections or the tumors. T is nothing but electrolyte balance. Here the electrolyte balance is also very important, so because due to the loss of water and also the loss of, so impurity, so the electrolyte balance is there. So for that reason, so that is concentrating on the electrolyte balance is very important. Or is nothing but, okay, so recording, so the intake and output chart. Okay, so this is also very important. Okay, so the point to manage, so that is diabetic insipidus. Okay, so this is regarding to the, so the clear cut information is regarding to this, so that is diabetic insipidus. Yes, the what happens in case of, so that is diabetic insipidus means, so the kidney unable to, so reabsorb water. Okay, so this is the most important problem in case of, so that is diabetic insipidus due to the, so that is ADH, so deficiency or ADH resistance. Here the slight difference between the diabetic mellitus and the diabetic insipidus is, in case of the diabetic mellitus, it is usually that is characterized with hyperglycemia. But here in case of diabetic insipidus, there is no hyperglycemia, but more loss of water is there due to this ADH hormone. Here in the diabetic mellitus, hyperglycemia resulting from the insulin deficiency. Okay, so there is slight difference between diabetic mellitus as well as diabetic insipidus. Okay, so this is regarding to what a clear cut information is regarding to diabetic insipidus.